Hello and welcome to JAMA Live. I'm Seth Kruger, digital mediator at JAMA Network Open. Of course, if you're following live, send your question or comments on Twitter or in the comment box on the YouTube or Facebook live videos. Today, we are talking about the association between receipt of unemployment insurance and food insecurity among people who lost employment during the COVID-19 pandemic in the U.S. We have first author, Dr. Julia Raifman, with us. Welcome, Dr. Raifman.
Thank you for having me.
Well, yeah, really glad you could join. This is a really interesting topic. Of course, it's important and affects a lot of people. Tell us, why, who you are and why you did the study.
I'm Julia Raifman. I'm an assistant professor at the Boston University School of Public Health, and I conduct research on how health and social policies shape population health and health disparities. And we did this study because we started to look at the policies that were changing during the COVID-19 pandemic. We have actually been tracking the policies on the COVID US state policy database. And we saw that there was a lot of research going on into physical distancing policies and mask orders and COVID prevention. We saw there was a lot less research on social policies that are equally or even more important for shaping health, things like unemployment insurance policies, minimum wage policies, eviction freeze policies. And we also saw that there was a lot of variation in unemployment insurance policies by state. So we thought that was an important topic to investigate.
Yeah, and this is, I'm a medical doctor, not a social scientist, but this is something that I follow a bit, and it always seems to me, intuitive that if you give people money, then that it'll be easier in hard times. But the data on that doesn't, we always need data for stuff, and that makes sense to us intuitively. So tell us what you did and what you found.
Yeah, I think the COVID-19 pandemic is a really important opportunity to understand how policies that are important for people in all times are shaping health, because we have data like never before. And unfortunately, we have a lot of people who are experiencing these challenges all at once. But that also means that it's possible for us to study dynamics unlike ever before. And so that's what we did with this study. We used data from the Understanding America study. This is a study run by the University of Southern California, and they've done a fantastic job following about 8,000 participants since the outset of the pandemic. Every 2 weeks, they collect data. And what we did is we focused on people who were in low and middle income households earning less than $75,000 and who lost work during the pandemic. We decided to compare people who lost work, who did and didn't receive unemployment insurance, and follow them over time. And we looked at what happened to their food insecurity and eating less due to financial constraints as the pandemic progressed, and there were very high rates of unemployment that were concentrated among people in low-income households. And what we found is that unemployment insurance receipt was associated with a 35% reduction in food insecurity and a 48% reduction in eating less due to financial constraints. And then we also were able to look at what happened when the CARES Act $600 supplement, $600 a week federal supplement to unemployment insurance expired. And we found that $600 federal supplement to unemployment insurance was associated with almost a double reduction in food insecurity. So it really made a big difference. We also, to further investigate this question, looked at how the amount of unemployment insurance that people received was associated with food insecurity, and we did find that the more people received, the less likely they were to report food insecurity.
Yeah.
Go ahead.
No, please go ahead.
So we think that the unemployment insurance as a whole and the CARES Act federal supplement played a really important role in reducing food insecurity at a time when so many people are vulnerable to it.
Right. Yeah, and that's all great work. That makes a lot of sense. I'm going to welcome Trong Kong Trong, who's joined us. Welcome. We're talking about food insecurity and social support, or federal support during the COVID pandemic. Again, some of these numbers are just shocking. These are people who make $75,000 a year or less, and it was 35 to 40% had food insecurity or were eating less due to financial constraints in the survey, which is really impressive. And not surprisingly, it was concentrated in people who made less than $20,000 a year, which is pretty serious. Not being able to eat is bad, right?
Yeah, I think this was a really important outcome and a new outcome for me to look at. I have focused a lot of my work on mental health, and part of what led me to look at this outcome was seeing that the initial data on mental health during the pandemic really suggested, first of all, that everyone is doing badly and everyone's doing worse than usual. But the people who are doing worst of all are people who are in low-income households. I think being able to eat enough food is really elemental to our to being a human being,
Right.
and that's what we see. It's really distressing for people who don't have enough to eat. Unfortunately, it's also concentrated in households with children. So levels of food insecurity are greater in households with children. And like with so many aspects of the pandemic and unemployment during the pandemic, we also saw that there were large racial and ethnic disparities in food insecurity. And we know that Black and Hispanic people were more likely to lose work, but they were actually less likely to receive unemployment insurance.
Yep. And unfortunately, what we've seen throughout the pandemic is basically, a sinking tide sinks the smallest ships first. In To make a really bad analogy, and just those who are the most vulnerable, had some of the worst outcomes across the board. And with the combination of pandemic and then the response to the pandemic, which is very very costly for a lot of people. If we can't have an economy because you get sick and die throughout in the economy, it's bad for everybody. But it's good to see that some support has actually shown some work. And this is, again, I'm not a specific student of this, but from the data I come across, it's simple stuff. If you give people money when they don't have enough money, they do better. If you give similar, what I've seen with homeless people, with people who are experiencing homelessness, is that if you give people who don't have homes, there is less homelessness. It works out well for people. It doesn't solve all the problems, but it helps.
Yeah, absolutely. And I think there are several lessons that we learn from this moment about how we might improve our unemployment insurance system. And one aspect of that is covering more people. Unfortunately, most people actually did not receive unemployment insurance. Those people who lost work. And that's what we see across the country. There have been some nice stories on this and how that's the case throughout, like during the Great Recession as well. And that was the case during the pandemic too. So the CARES Act expanded who could receive unemployment insurance so that people who were gig workers and people who did part-time work and people who were excluded from unemployment insurance because they actually earned too little, that some of them were able to qualify for unemployment insurance during the pandemic. But we still saw, even with those expansions, that most people who lost work didn't receive unemployment insurance. So I think that's really important to think about how we can expand unemployment insurance to reach more people in the future. Also, just seeing the role of the amount of unemployment insurance and how that was associated with food insecurity, I think that's really important to think about for improving unemployment insurance. And then part of the reason that we've seen few people covered by unemployment insurance is that states have had a challenge administering unemployment insurance, especially during a time of crisis. But I think reconsidering how we administer unemployment insurance and whether we might federalize it, those are important considerations to make for the future. And then I think just seeing the results on mental distress and how much people in low-income households are depending on unemployment insurance for their most basic needs, such as food insecurity, that suggests we might consider automatic stabilizers in which, in times of crisis, people may have the opportunity to have unemployment insurance amounts and duration automatically increase.
Mm-hmm. Excellent points. We've got Brock Allen, Arth Barbosa, who've joined us as well. We're talking about unemployment insurance during the COVID pandemic and food insecurity. So that's taking us right around to the end of our time. Anything else you want to add here before we close up?
No, thank you so much, and thanks for bearing with me as we have some kiddos in the background, part of the pandemic work from home experience.
Yep, I think it's something we could all relate to. Right before we hopped on, we had a whole thing with my wife, my dog, and paint in the closet behind me, so we all relate to that now. And again, this is one of those things where, it's the pandemic. A lot of people are losing jobs because we have to basically shut them down in the economy so we don't all get sick. And part of it is trying to mitigate the mental health, and really day-to-day life effects of it all. So thank you so much for joining us, Dr. Raifman.
Thank you. Thank you for having me. It was a privilege to be here.
Great. Thanks. Of course, you can get this article and more at JAMA.com, where everything is free and open access. We've got new articles coming out every day at 10 a.m. Central Time. And join us next week on February 9th at 3 p.m. Central again for the next episode of JAMA Live. So take care and stay safe.